Neck pain is caused by problems. Muscle strain is the main cause. Neck pain stems from muscle strain due to prolonged sitting and device use. Neck muscle strain mainly occurs due to sitting for a long time, using phones or computers with bent necks. Using phones or computers leads to a sedentary lifestyle. Working with a bent neck strains our neck daily. We work bent-necked, we're falling over while working. Because of this, we have to do our daily work in a second. Sudden muscle stretch and flexibility. So, muscle strain occurs, and this is one of the main reasons. There are also a few other causes. Neck pain often results from bending and stretching neck bones sideways without muscle support. Pain is linked to neck bones. We twist our neck. Cushion discs are crucial. We bend, stretch, and twist our neck. Now, without these muscles, we refer to the cushion discs that are located between the neck bones. Sometimes that disc can often protrude slightly, causing pressure on the nerves. The third important issue that also causes neck pain is degeneration, cervical spondylosis. These three main issues are the causes of it. Neck and arm pain are connected. We'll discuss permanent solutions in this video. One by one, we will see how these issues arise and how we can resolve them. What are the permanent solutions for this? In this video, we will look at the details about that. Neck pain is like that. If you look at it, it's been a long time. When we slightly bend our neck while working, it can be because the chair is too high. The table is low and the computer is slightly below us. We are in a bending position. And we have already discussed how to manage this pain. To reduce it, we have said that lifestyle modification is a threefold chair. Height, gummy, panikong, system phone, whatever, electronic. Even if you have gadgets, make sure to keep them at eye level. Look, if you are bending down like this, what happens to your neck is, the more you bend, the more the muscles stretch. That's how it works. Problems arise. In the initial stage, muscle strain becomes a significant issue. As the days go by, strain in the neck can lead to strain in the discs as well. Evidence of bone degeneration is proven. Work areas should be at eye level. Our work areas should be at eye level, like computers or phones. Avoid bending down. The areas where you work should be at eye level. Avoid bending down. If straining, change position. Avoid bending down. If you feel muscle strain, change position. Stretch. If you feel muscle strain, change position. Stretch, relax, and massage. Do some light stretching for a while and then relax a bit. After doing a massage, treat it like an appointment. This will help reduce the pain. Now we are talking about acute strain, means muscle strain. Two types of muscle strain, sudden and prolonged. Sudden strain occurs in certain positions. This is how cramps that have been going on for days and sudden cramps, instead of just sitting in a position when we are working, we tend to bend down to pick things up. This neck strength is for holding that kind of flesh. Exercises to do everything. Please don't do it because that's what it is. First, the muscles stretch and then they get injured and damaged, which is where the pain comes from. The first thing you need to do for that pain is to give it some more relaxation. Give it some rest, and you can do a nice massage. Sometimes a hot water massage works too. You can give a nice light massage like this, and then apply some ointment. If the pain persists, pain medications can be taken for that as well. Suddenly this shooting pain is really intense, doctor. The pain is very severe. They said, I can't bear it anymore. I can't turn my neck. That's what they said. When the pain is unbearable, you can get an injection for your bones. According to the advice of the physiotherapist, this is related to acute neck pain and muscle strain. Exercises for muscle strengthening. You should do exercises like this. You shouldn't do these exercises. If you do, the pain will increase significantly. So that's why when it comes to acute neck pain, it can also lead to chronic pain, which is very severe. Because of bending down like that for days while working, this is what leads to it. We refer to it as posterior chronic neck pain, which has been present for a long time. Massaging and using ointment, ensure position is right. Use gadgets when possible. The position needs to be correct. You shouldn't bend your neck down while working. You shouldn't work like that. As much as possible, use electronic gadgets. You need to keep your eyes looking straight when using your phone. Instead of using it while bending down, hold it up. Use it without neck pain. Just keep your hands up like this, and you can use it for as long as you want. To simply avoid neck pain, if you look at this neck, it should go like this. One important thing to note is that this neck is getting weak because of this. Neck core strengthening exercises reduce neck pain and avoid muscle strain. Strengthening exercises can help avoid pain. Basically, this pain can be avoided. Muscle strain has been around for a long time. Chronic neck strain can lead to problems. Pain often occurs in the neck. When it comes to muscle-related issues, there will be pain in all those areas like this. The problem is that this can be more pronounced in the neck at times. Vitamin D deficiency can lead to muscle pain and affect neck strain. Correcting it is crucial. We need to fix vitamin deficiency to address chronic neck issues. When it comes to sprains, it can be related to positional issues. Then there's vitamin deficiency. If you look at fibromyalgia, it's an exercise to strengthen those muscles. When the pain is severe, you can take medications as needed. I just wonder why it came to that extent. What is the root cause of this issue? If we correct, this problem will be fixed. This will be fine, but it depends on the muscle strain. That's the next issue. If you look at the main problem, it's the joint between the neck bones. The joint feels like a cushion. It's elongated. For days, when you're in a certain position, sometimes when you put weight on it, it can lead to muscle strain. So the next stage is that the tissues get strained and the joint needs to be in this position. Later, when the nerve gets pinched, this neck joint gets affected. When it gets pinched later, if you look at this area, it's at the back of the neck. From the spine, there are 2 arms that extend from it. Nerve spreads, carrying sensation to arms. Touching, sensation returns through spine. When we touch something with our hand, the sensation continues from there. Sensation comes back through the spinal cord to the brain. The brain commands us. It goes to the brain and brings it here. From there, it sends signals to the hand. The brain gives us orders. This is what the nervous system does. Now, what happens with this condition is that the nerve comes from the back. We mentioned that the nerve comes close to the joint. As long as the joint is flexible and in good condition, those joints, the wall is indeed clean, as I have already mentioned. The gel-like part inside the annulus fibrosus is called the nucleus pulposus. This acts as a suspension. As long as it is in good condition, there won't be any problem. If it gets pinched, the nerve won't be compressed. It will return to its old state sometimes. When the joint breaks through the wall and gets snatched out, it can cause a lot of damage. It slightly pinches the nerve to a certain extent. Mild, moderate, severe. That's what we call mild. If you look at it, it's in the initial stage. This is what we call neck pain. Just because that area is pinched, there will only be neck pain. The second thing is, if you look in the middle stage, the nerve gets pinched and compressed. There's neck pain. With pain, the arm gets numb. I can't sleep. The arm feels like it's gone numb and is throbbing. It will be like before, but it will be much more intense when it continues. They will keep on shaking their hands because they are in pain. You can't hang your hand down. You have to lift it up like this. That's the extent of it. At night, there will definitely be much worse pain compared to the day. The reason for that is, that night, as you can see, there's pain while resting. When we say rest, it means there is a problem related to the nerve. When the joint shifts and compresses the nerve, rest pain happens. This is related to the neck. As far as the joint displacement is concerned, what stage is it in? As I literally mentioned, if that's the case, we should immediately consult a doctor and get examined. Neck pain, MRI checks disturbance. First stage shift causes pain. We'll do an MRI scan to see if there's a lot of disturbance. If you look at it, in the first stage, if the joint has shifted, there will be neck pain. There will only be pain, lasting. We call this muscle tension. If we think about it, even after the treatment, there won't be any improvement. I got an MRI done, and then the medical management started. In this situation, we can manage the joint displacement with medical management simply. When there's no problem, just taking pain medication is enough. But when the pain is severe, we can do injections to fix it. We can do physiotherapy, and perhaps we need to use a belt. Rest massage, early treatment helps disc. Hot water massage is key. Start early. Up. In the management, we can start treating it at an early stage. This disc is a bit, when it bulges and causes neck and arm pain. Similar pain may occur in the left arm, mimicking a heart attack. Pain may occur in the arm. Pain may also be in the chest. When the same issue occurs in the left arm, it can feel similar to a heart attack. Chest pain is similar to heart attack. Chest pain, neck pain, chest. When there's pain and the arm feels numb, what do we do immediately? Finally, the doctor will consult and check the ECG. If the ECG is normal. If you look at it, if it comes like this in the left arm, then is there a heart problem or is there a doubt about a neck disc problem? The heart doctor checked and said everything was normal. Then we will consult the orthopedic doctor and we will get an X-ray done. If we look at the MRI, we can see that this problem is due to a disc herniation. We will confirm by providing the necessary physiotherapy methods for it. Medications to reduce nerve compression and irritation can lead to improvement within weeks. If we provide drugs to reduce inflammation, it will improve in weeks. In a few weeks, it will completely improve. If we keep this in mind, we can ensure that we can do this in an intermediate state. We will look at the MRI. There will be disturbances. MRI and physiotherapy can manage it. MRI scan of the intermittent condition, physiotherapy medical scan. Management can be done without surgery through simple physiotherapy management. We can correct it with medication when the problem becomes very severe. In the third stage, we start with physiotherapy and medical management. In an intermediate state, we can manage it with therapy and treatment. All right, we can do that. The discs are really bulging and pressing on the nerves for a long time. We took medications, medical management, and physiotherapy. If it doesn't improve even after doing that, we will get an MRI done to confirm that it hasn't improved at all. I've been experiencing pain for days. My arm feels like it's going numb and getting stiff. The hand was all weakness. It was a thing that was drunk. I can't sleep at all, doctor. I can't sleep at night. My whole arm is numb. For those who are in this condition, you should do physiotherapy and all that. For those who say there is no improvement, you can be cured with small surgery. For those who are selected, we can immediately perform a small surgery. This immediate cure can be achieved through this surgery, which targets the nerve system. If there's a problem, surgery is needed. Once done, pain reduces and relief is immediate. If it becomes necessary to cure it, then it has to be done. If needed, but once it's done, the pain will immediately reduce and there will be immediate relief. The pain is gone after surgery, and at night, it won't be there at all. It will start to gradually reduce a little bit. If you come to them and sleep, is the pain you give them clean? There won't be any need for further treatment after the surgery. This is for those who are aware of it. We will only do that if the medical methods haven't cured it. So you don't need to be afraid of that. There is absolutely no need for that. If you look at what the fourth stage is, look at this. In the start, we did it like this. And in the mid stage, we're doing advanced physiotherapy. We assess how it goes. If it doesn't improve, we will do surgery. If you look at what the next stage is, it centers at the back, bulges centrally, pressing on the spine, impairing one arm. It's bulging centrally instead of bulging to the side, which compresses the spine. So what happens is that it affects the spine. Now one arm is completely out of function and the spine is affected. When it bulges centrally, the nerves are completely affected in both arms and both legs. When there is pressure in the main connection, what happens to you is there's a problem called cervical myelopathy. What happens is that this hand has pain, and along with that, the legs are also the same. Without balance, the legs become weak, and when there's no balance, walking becomes difficult. Look, they will stumble walking. When they walk, you can see their shoes. They don't even realize that their shoes are coming off while walking properly. For those with diabetes, this problem will only occur in the feet. But this, neck vertebrae shift, cervical myelopathy, weak legs, numb arms, legs weak, arms numb, MRI, severe. It will be like last time, a clinical examination and MRI. If we look closely, the neck vertebrae problem is quite severe. The spine is being compressed quite severely. And it looks like this. If you look at the spine, it has gone to this extent. Look here at the spine. In the area where there's less pressure, the spine is in good condition, but the vertebrae are misaligned. Vertebrae misaligned, affecting nerves. White indicates cervical myelopathy. The spine is well aligned on one side, and the entire spine looks good like this. The spine should be well aligned, and there you can see the white color indicating cervical myelopathy. So we're saying that the spinal cord nerves are getting compressed. Nerves there become fibrotic. If myelomalacia is present, immediate surgery is needed. If there is myelomalacia like this, we need to address it immediately. For that, surgery is definitely needed, even in the early stages or in between. In terms of treatment methods, we have advanced medical techniques for severe disc prolapse. We'll manage the medical treatment as much as we can, and if it doesn't improve. When problems increase, surgery becomes necessary for cervical myelopathy. Surgery is needed if nerves are compressed. Using microscopes, we perform surgeries with precision. The latest advanced techniques have come in a lot. We are using microscopes to perform surgeries. So, we can do it precisely without any issues. There won't be any problems. Now, if we leave this, what will happen is that you will be afraid of surgery. When we leave this, what are you afraid of? Are there bigger problems than this? Now, I'm saying that this is a good aspect. We need to address it. Come and get immediate treatment for your bone fracture by consulting the medical department. We need to take the appropriate scans to understand what problems he is facing. Make sure to completely recover from it, especially regarding neck pain and any associated symptom. For sudden muscle spasms, medical management is just rest. Don't exercise if pain is severe. Rest if swollen. Consider treatment if pain persists. Whether it's tightness or burn, we can schedule an appointment. We can fix that in a couple of days. If the pain doesn't improve, then we might need to consider further treatment. Physiotherapy is often needed for sudden neck pain. Don't do muscle strengthening exercises or muscle stretching exercises. If you do that, the pain will increase. Chronic muscle spasms are very intense. It's been more than 20 days, or at least over 15 days. At that time, you can manage the pain with medications such as ibuprofen. Appointment similarity is related to the strength aspect. We can do stretching and strengthening exercises. We need to check for other causes. What be the reason for vitamin D3 deficiency? Is it related to conditions like fibromyalgia? We need to confirm if there are any diseases and then provide the necessary treatment for that. If you combine it properly, it will heal completely. If you look at the third aspect, there can be issues with the neck muscles. Persistent spasms may indicate disc shifting affecting nerves. When the spasms persist for a long time, no matter what you do, they won't get better. So the disc that is located between the neck bones can shift and press on the nerve. Pressure can cause problems, but to what extent? Is it mild or moderate? Severe neck pain causes arm weakness, numbness, and tingling. In both stages, neck pain with arm weakness. You might feel shock-like pain in your arm. Together, the hand is numb and feelingless. There will be weakness in the arm, and it will feel like a current shock hitting it. You can't hang it down like this. In this situation, your bone. Consult a specialist doctor, and based on their advice, in the initial and intermediate stages, medical treatment. There are treatments available, but if no improvement, surgery is an option. Cervical myelopathy is a possibility. If the methods used do not lead to any improvement, sometimes surgical interventions may be necessary. Sometimes, if you look at the fourth aspect, it could be cervical myelopathy. Legs may malfunction. Legs lose balance, shoes slip off. The legs won't be paralyzed, they will be able to walk. But if you look closely, the legs there won't be any balance, and when trying to walk, the shoes might slip off like this. Surgical treatment can be done for the problems related to cervical myelopathy. Get a permanent solution to neck pain without pain through effectively. We can ensure that no further potential issues arise. Thank you for your understanding. Goodbye.